We believe the medical setting is a wonderful place for suicide prevention, that if we can have universal screening in the emergency department, in the inpatient medical unit, in the outpatient primary care settings, that if physicians and nurses start asking kids about suicide risk, that we could actually reduce the suicide rate. Kids who have chronic medical illness and are in the hospital, that's a good time to ask them if they're having thoughts of suicide, because they have a lot of the risk factors for suicide. So we created this screening instrument, and the way you create a screening instrument is you take a bunch of candidate items. So we had 17 candidate items, and then you take a gold standard suicide assessment. And you whittle down these candidate items until you have the fewest number of items that can capture the same kids that the gold standard suicide assessment captures. So that's what we did. These triage nurses really needed to find out who was in immediate danger, who needed further assessment, who was okay. And so we gave them a 4-item tool that captured the same kids as a 30-item suicide assessment. Now what we're seeing is that some hospitals are actually starting to implement suicide risk screening for all the medical patients, so universal suicide risk screening. And so what we're doing now is we're consulting with implementation, and we're trying to develop evidence-based guidelines for algorithms, and this is how you implement a suicide risk screening tool so it doesn't overburden your system, and so it's feasible, and so that you can carry on with this suicide risk detection and it doesn't overwhelm your regular hospital workflow.